I did want to say something before we invite Rachel, and actually Rachel and David, you can join us now. Just some clarification around the table. There's been a bit of confusion really around our work around this. So I just wanted to clarify a couple of things. There's a mental health social care strategy and the mental health strategy. So are people seen all of those? I just wanted to make clear that the mental health social care strategy is coming from the council, and that's our attempt to sort of say to the partners, the clinical commissioning group and all the partners that we have to work with in health, this is what we're thinking about integration. So that's what that is, and we are not scrutinising that. Obviously there'll be some overlap. What we are scrutinising is the mental health strategy. The mental health strategy is much wider than our social care strategy, which is obviously important and it's a component, but the overarching strategy, and what we are interested in is that the extent to which we are integrating and improving outcomes for people with mental health issues, their families, children and young people, and everyone involved. So, is that clear? Is that clear?
Yes, yeah.
Okay. I'm clarifying that because when we tried to get reports off officers, there was a little bit of confusion, and I wasn't clear, but now I'm clear. And now, just to clarify that. Okay then, so I'd really like to welcome Southwark Group of Tenants Organisation, and we are looking at mental health and young people. I know that you had a deputation to Cabinet. This is slightly different to that because we are the Scrutiny Group and we can make recommendations to Cabinet. That's the process. We do that. We make our recommendations to the Overview and Scrutiny Committee, and that comes to Cabinet. We are doing an independent review. Our review is of the mental health strategy, and we are really interested as a part of that strategy and our scrutiny of that strategy, which won't be out until the next 3 months, is it, Gwen?
Yes, right, at least 3 months.
Yeah, within the next 3 months, and we'll be glad to know within the life cycle of this committee it will be out, so we will scrutinise that. But that doesn't mean to say that we can't get on with looking at this area, which is why we're really pleased to have David and Rachel. So, without further ado, I just wanted to hand the floor to you, if you wanted to give us a bit of flavour of your work.
Okay, as I said earlier, my name is David McLean, and I'm the Campaigns and Research Officer at the Southwark Group of Tenants Organisation. I'll just say how we'll present today, so that's a bit clearer, and hopefully we don't confuse anything with respect to the strategy and the terminologies that exist all around. Well, I'll let Rachel read out something which she put into a policy document or a kind of briefing that we've done for your benefit in response to you guys talking about it. I know we sent it very late. They've been very busy with other issues. And then what I'll do is I'll try and just highlight...
Could I just... Sorry, David. Everyone's read that, haven't they? When I came in, everyone was reading it. So,
fantastic.
So thank you very much for submitting that.
So I'll be able to summarise it even quicker, and then we'll take any questions you may have from us. But a little bit of background on the Youth Forum.
Yeah.
I set up the Youth Forum within the organisation as part of our strategy to get more young people involved in tenants and residents associations. And I've been fortunate enough over the past several months that it's attracted some of our most strong and able young people who are really concerned about lots of issues, and particularly around the community and social cohesion. So primarily it's a good Trojan horse into the SGTO, which it can help the SGTO itself move forward and also replenish some of our TNRAs, members and so forth, and they can bring in new ideas. But as they're finding, the housing and TNRAs mingles into lots of things, and they're getting nicely swept away and having their contributions in. So that's just a little bit of a background about the Youth Forum. Primarily it's there to tell people, young people, about TNRAs and how to get involved in their communities through a variety of different forms which may be more susceptible for young people to come in. And issues like this are getting them round tables and talking, so which is great. So I'll let maybe Rachel, because I read what she had written, maybe because you've read it, I don't know whether you want to read it or summarize it. It's up to you about a young person's perspective about mental health.
Well, I have a slightly different version with a new paragraph that I added at the end, but I can just briefly summarise it. And
you've got as long as you want, Rachel. You know.
Thank you, Chair. So this is really just like a personal reflection, just based on people that I knew at university and in my own network, because for sure I think young people today growing up have a very difficult time, especially people from minority ethnic groups who may not think that they have anything to cling to because that organisation that would be there for them is not established enough, or if there's social kind of issues about social stigma and family values that kind of contradict the kind of contradict and go against their need for support and for help. So just trying to sort of describe, I guess, what I saw and how I personally myself felt unable to deal with some of these issues and help people through these things. So yeah, I think it's true that often we see the sort of the face of sort of ill mental health in terms of, we see it in other people, like you're very depressed today, or you're incredibly insecure, and while that sometimes to an extent we all feel it, I think if it's a kind of pattern that occurs, often I think there's a history of abusive and emotionally damaging relationships behind not only the judgments that we put on other people, but also these individuals themselves. And I think in terms of the policy documents I've seen, coming in from the SGTO and just going on the council website, mental health it's never quite so explicitly spoken about, I think, but communities that would kind of benefit from mental health support, as outlined in policy documents, often kind of focus on, I think, maybe situations where it's very obvious. I don't know, such as if a young person has a disorder that is categorised in the DSM, or it's something that can be diagnosed, basically, as opposed to just a series of stresses and factors which are not at all invisible, but you wouldn't be able to link it. So the links haven't been made so clearly and strongly. So I wanted to stress that ill mental health is not only found in young people with who've had experience of homelessness and been imprisoned and been in abusive relationships with addictive substances or people, but it's also in terms of just in terms of anything from academia to my friends whose parents work in small businesses, to my friends who are actors and artists and community workers that I've come into contact with. There's a lot of I think trauma there. So this might all sound quite abstract.
So what, Rachel? I'm just trying to get underneath that. So what are you saying? We're too specific in our diagnosis or in our definitions of what constitutes mental health. Are you saying that we're not broad enough?
perhaps.
Yeah.
I'm saying that there's a consciousness about mental health that kind of looks at the very extreme face of it.
Yeah.
But we need to put it into our consciousness that mental health is something that probably affects all of us to differing degrees, but also it affects what is seemingly functional as well.
Yeah.
So, for example, if I can just talk about the British Chinese community, like
Yeah.
talking about people who are who work in the takeaway environment, there's no representation there. There's no contextualization of the issues that happen. However, I did see in documents such as the new Southwark Plan, there were discriminatory policies against hot food takeaways, but the link has not been made between the prevalence of these kinds of small businesses that are run majority, I don't know if it's majority, but a good proportion of them are run by people with an ethnic minority background who might not have the language or the transferable skills to work in any other sector. So the policy, I think, was something like within a certain radius of secondary schools, you can't.
Absolutely.
You can't have a takeaway, basically. And while I agree with what that policy is trying to do, in my mind, I think that's just bandaging, and I think that that might solve one issue, but it would problematize others. Such, for example, like if that was my parents, I know that we'd be in trouble, and that would affect me. So it's just about.
Also, takeaway. Not all takeaways are junk food, are they? So
no, some of them are like, family food. They're not organic vegan stuff, but like that these are people's livelihoods as well.
No, I understand.
So it's just about kind of, as you say, broadening the kind of the picture of mental health.
Yeah.
And
that's a good example. Thank you.
Yeah, thank you. And just what else? Yeah, just trying to really emphasize, I think, families and how it is important to not only be talking to groups that exist like the Youth Forum, but also going out of our way to maybe employ translators or maybe something like that, and really kind of try and bridge that gap if it's within your power, because sometimes people lower down the hierarchy feel that not only are they doubly disadvantaged in that the system doesn't look out for them, but also how are they able to take out of their lives and their time and their energy and their efforts to kind of talk to you when you're just a brick iron wall.
Mm-hmm.
Sorry, that's not a metaphor that makes sense, but if you're just not someone that's gonna listen to a small person like me, then we if we have the privilege and honour of being able to do these things, we should put the resources there. I would like to finish on just one last paragraph, because I should probably kind of stay there now. This is not in the document, but to close, mental health is a conversation we need to have. The Council should be actively looking to hear about and continue the work of initiatives that empathetically and inclusively interrogate the true nature of mental health in the young people of Southwark. These initiatives explore strategies for equipping young people with tools to manage their mental health, as well as improving the mental health of society. It is about tackling issues with historical awareness and respect to diverse communities and stories, and not only looking to stamp out the visible symptoms. It is about opening our minds so that we can change them, and having the courage to understand the names that we are so ready to use.
Thank you very much for that. I have to say, Rachel, never ever describe yourself as a small person, because that is not what we see before us. That's really excellent evidence. You're a giant, well, compared to councillors anyway. We're relatively small in our communities, but I just wanted to say never describe yourself as that. And thank you so much for that eloquent picture. It's really given us a lot to think of. Okay, David, did you want to say something before I open it up?
Yeah, before I do, I just want to say how appreciative I was of her comments, because as a policy research officer, sometimes it's nice and dry to bring lots of facts and opinions together, but hers is a real kind of personal feel, so I appreciate it. And what I get from that, and I think for policy-wise, is that the parents, in this respect, of immigrants, or the children of immigrants, are probably at higher risk of mental disorders because their parents perhaps have got limited economic choices.
Yeah.
And that might be seen, let's just say, in the black community, where maybe the first waves of the generation that came, they weren't integrated fast enough, or maybe not still integrated fast enough into the economy, and therefore we have maybe a higher prevalence of adults who were young at that time, with all the barriers that were being faced because of their parents' lack of economic power, and we may see it today in either prison or in other institutions. So I thought that's something that I got from that. You've all read my, you've all skimmed or read through it, but so I'll just go to what we hope we can give to yourselves, and that's some of the questions to think about. Is housing discussed on health and well-being boards in Southwark? Because one of the good things about working in housing, I realized that housing is so important to well-being, critical, and that's why social housing, I think, is important. That people are not stressed about housing, even in the, I'm in private accommodation. A lot of the money that you indirectly pay me goes to a landlord, and that puts pressures in other realms. But there's a lot of people who are living on the breadline, and if they can't fix their homes, they've got repairs as well. If repairs are bad, if lots of things aren't going right in the house, for young people in particular, do they have space to study? This is what I was asking Tom Budgeridge, who's working on the new Southwark plan, and the designs. Are houses equipped to deal with people's state of mind? And there's still a discussion of whether housing should be on well-being boards, and I think I mentioned something there. But
okay.
But and there's some other questions there that I hope that can benefit you. But we did meet with.
Can I just clarify? Do you know that they are not on there? Because my understanding was that the health and well-being boards were quite inclusive, and that's why,
I don't know. That's why I put the question.
Oh, sorry. Yeah.
I mean, that's as I said. I'm hoping these questions
are
for us and you that you can use as well.
Sorry.
But I do know that housing, well-being and housing at the moment, it's not health and housing are not linked together.
Yeah.
It's not linked together in national policy.
No.
And I'm not quite sure it's linked in local policy. And that's what. And should it be? Is a question that we're asking. In Southwark, with what's going on in housing, all across the country, we've got a housing crisis. So, is that going to help the generations going forward? Are there effective monitoring procedures for care leavers regarding housing and accommodation? Because again, care leavers, 11 and 15 is where the traits of mental health, if they haven't got it from the earlier beginning, start to begin. Care leavers are more vulnerable. Do we in Southwark have procedures to monitor this? Do we know how many people are leaving care and they're fine and they're getting into jobs, into the professions, or are they going prison, mental, or accessing social services or mental health? In light of welfare reforms which exclude under 25s, what appropriate measures should Southwark take to avoid under 25s becoming homeless and the associated stresses? The main feature of the paper is that homelessness is one of the key reasons why young people have mental issues. I think they're obvious as well. If you don't have a stable home, sleeping rough, no money, no adequate nutrition. So with the benefits being excluded from them, what's going on? The youth provisions in Southwark, intervention, recreational and civil, and I think that falls a little bit into the youth services question. That's a larger question. What emphasis is there in strengthening young people's resilience and thereby reduce their risk of encountering mental health problems between 15 and 11? One of the things that we met Victoria Mills after our deputation yesterday, and what we've proposed, and again I sent this to Julie for your perusal at any time, is that we create a steering board where we, the SGTO Youth Forum, will facilitate it. We hope Councillor Mills will chair it. We can bring the communities groups together and the young people together. The borough commander, for example, there as well, any other health boards, and try and work in an organic way on the long term to say, okay, then, are the current services working? And then you can ask us to go out to get young people and find out their views. As a campaigns and research officer, one of the things I'm trying to do at the SGTO is make us data rich, whether it's to do with residents' issues, young people, and what I'm doing with the Youth Forum is trying to get them to become researchers and to find out. Peer-to-peer, I think, is very important. And so I would hope you'll be speaking to Victoria Mills and saying what's going on with that. But she's agreed in principle, but she'll get back to us, and hopefully we can meet quarterly and look at things, commissioning, services, evaluation. And she was asking yesterday a pertinent question, which was, what's the purpose of this board if we get it? We don't want another talking shop. And she said, go back and think. And one of the things I was thinking about was, actually, this is the place where we can solve problems, where we can come up with ideas and make recommendations.
Yeah.
And finally, does Southwark have any data to assess the opinion of young people regarding mental health? And I'm just trying to position or trying to steer the forum into that position where we can assist in trying to get that data to the council, to each other. Because I think, are we having, what campaigns, I know Southwark got what campaigns are being held to discuss mental health? In some traditional communities, and even in the dominant culture tradition, for example, men, it's not, kosher to start saying, I'm stressed, you have to, stiff upper lip and all that. In other traditional cultures, especially with the men, they can't talk about their emotions, they're not going to talk about their emotions, and that's coming back, and that affects their children, because if they're not being emotionally honest with themselves, that might make it more difficult for their children to be more emotionally honest with themselves and their parents, and then they might be more susceptible to maybe drug abuse, which is not clearly linked to mental health, but there's some kind of definitely the stress does lead to the drugs in some cases, but of course that's social expectation as well about and it happens to middle class children. You need to become a doctor, you need to become this. That can bring its own level of stresses, and I'll probably close if it's too much. But what we want to do is establish a relationship with the forum, with committees which affect young people or housing, and hopefully try and feed in. And this is a start of us trying to help you guys, help the council in general.
Wow, thank you very much for that, David and Rachel. That's all useful stuff. Just so you get an idea of the structure before I open it out, just for clarity, is we don't have masses of powers. Scrutiny is a backbench function, but what we are able to do is we are able to put our spotlight on important issues to our constituents, and the mental health of children and young people is very important, to all our constituents. So we're able to shine the light on that, and we make recommendations to Councillor Mills through the Cabinet. And we've been quite successful so far, haven't we? Most of the stuff we've recommended, she's implemented. So, we feel quite positive about that. I did say at the beginning, we are looking jointly at the mental health strategy. So all of this we can take as evidence, and we can put that with our analysis of that strategy, our scrutiny of it. So, I think that would be a good way to take that forward. And the questions. I did want to, before I open it up, I did want to say that the thing about the health and wellbeing boards is that they were brought about precisely, to make services better for people. And my understanding of it, although I will be corrected, but my understanding is that local government is in the driving seat of that. So housing will be intrinsically involved in that, because, for example, I think Peter John chairs it, doesn't he?
Yeah.
The leader of the council chairs that, and he is responsible in his portfolio for all of the cabinet. So he's responsible for what Vicky, or Councillor Mills does, for what Richard Livingstone does, and he is the lead member for housing. So the whole point of the Health and Wellbeing Board was to get that synergy, but that's not to say that it can't do better. So raising this question, will be an excellent thing, even though that it should be, firing on all those systems. You can always make better links between housing and all the other services. So I think I've said enough for the minute. So I've seen Sandra.
Yeah, these questions, did these questions go to Cabinet as well, or are these additional questions?
No, this is a paper that was specifically for this committee.
For the mental health strategy.
So can I ask the officer, do you feel you could answer any of these now, or do you want to come back to us with it?
What I will say is that in fact it's been very, very helpful listening to this, because we are in the process of developing our joint mental health strategy, and so the points you raised about the I guess the emotional well-being of young people and the invisibility sometimes of those mental health issues in young people because of stigma, because of marginalised groups, I think is something we will be looking at as part of developing that strategy. So I think it's been really helpful listening to that, because I think there are the services for people that have got diagnosis of mental health issues, but we're talking about having a strategy that deals with some of the more preventative elements of mental health, so we get better outcomes earlier. So all of what you have said, making sure that we engage with the right communities, understanding trauma, providing early help for young people, that services are accessible, that meet their needs, is something we're very much wanting to do. So I think that will be picked up very much in the work towards developing our joint mental health strategy, and also looking at the children and adolescent mental health elements of mental health. So I think it's very, very relevant, extremely topical, and something which we will be addressing as we develop that strategy. But it just highlights the importance of engaging with young people. That it is very, very rich information. So
are any of these structures in place? That's possibly, like, from my research, I just wanted to know for the Southwark point of view. So if I go back, because I gave this to the chair of the organisation, so when I go and report back to the board, they'll say, so did you find out?
What might be very helpful,
you can have the document.
Yes,
and you can get back
there's
to us.
quite a lot of activity happening around the transformation of child and adolescent mental health services, with a focus on prevention, and the government has got the CAMS transformation plan where we're all responding to that. So elements already are happening around developing child and adolescent mental health services, thank you, where these elements are going to be picked up. So there's already investment nationally around child and adolescent mental health services, and we are focusing some of those resources on early help services in Southwark, so wanting to do some of that preventative wellbeing work that you're talking about. So it's already started, the strategy's already started, and the joint mental health strategy that we're working towards will be picking up those issues as well. But we just need to make sure we've got the engagement strategy that sits alongside the development of the strategy right, so we can pick up your views. So
thank you very much for that. And obviously in our scrutiny role will be an additional piece of insurance to make sure that happens. Yes. Okay, I've seen Charlie and then Kath, then some. Okay, we'll go around this way.
Thank you, Chair. I thought it was very interesting what Rachel was saying about ethnic groups. Now, I know I used to work in homelessness for the local authorities, and it was very rare you'd have an application from someone from the Chinese community. They tended to sort of look after themselves in a way. Now, my worry about that and other small groups is that it's not being dealt with. It might be being dealt with by the family, but maybe not by professionals. The other thing is other ethnic groups. We've got young people who go to school and they see their school friends are free and easy, and then they're going back home to different disciplines, religious disciplines, and this sort of schizophrenia almost between between what they see at home and then what they see in the outside world. That must be hard. That must play a part. And we should talk about engagement. It's the different groups, like the Chinese, like Somalians, maybe some of the Muslim groups who, and as you said, it's not macho to be mental health, or depressed or whatever. So within some communities, I mean, it's always been taboo, I think, mental health. It's only in recent times, I think, that maybe in this country we managed to get over that. But I think there still are groups who probably see it as a weakness or whatever, a failing, and that makes it even worse. It must be terrible for youngsters. So the engagement part, I think, is going to be very difficult to get to some of these very smaller groups who tend, for all sorts of reasons, tend to do things on their own and away from the mainstream.
Yeah.
Can I weigh in on that just briefly?
Yeah, of course, yeah.
So I think parents, sometimes mental health is not an issue, or it was just they never maybe went that kind of interior into themselves. I think mental health is something that's always been there, but it's definitely very present now that those parents' children are growing up and finding that not only is there, because of different policies and different laws, and cultural differences, that they have to deal with the aftermath of that. So it's about keeping the family together and also kind of navigating the outside of society. So there is that inward faciness, but that doesn't just come from the communities themselves. It comes from just the wider picture of society, like how many Chinese MPs do you see in Parliament? How many, it's not just. This is the issue: is that it takes a lot more than conversation, I guess, with individuals and thinking that it's inward. It's more complex than that, I want to say, and I would like, I think, to link it more to just Britain's history with its migrants and its immigrants, because we have to take a historical look at everything and not just see it as if history just started now and as if mental health is just exploding now. So that's not, and it's not like it's just a response.
Yeah.
Just to try and thoughts in that.
You have to understand.
Yeah.
You have to understand where it's come from in order to understand where it's going. So you're absolutely right of having that, analysis. And I think it's not just the Chinese community, is it? It's like basically right across the piece. And it's actually great to have this discussion. I agree with Gwen, because we want to make something which is going to. We have such a diverse community in Southwark, and unless it is going to hit that all those diversity issues, it won't be worth the paper it's written on. So we're all committed to that, and to have your input is just really good. Okay.
Okay. Coming back to your questions, on the second question, the effective monitoring procedures for care leavers, we do have a corporate parenting committee, of which I sit on. You're on that, aren't you, Joseph? And we take evidence, and we are overseeing all the looked after children in Southwark. And there is a group called Speaker Box, and they are
Do you know them, Rach? Have you heard of them?
Box?
I've never heard of either.
Okay, well they are specifically for looked after children, and it gives them a voice, and they have their own committee as well. So it'd be worth getting in touch with them, because they monitor.
Again, that's where the forum, through this dialogue, the forum can then try and spread this into the community. So Kieran, I hope you can't be here, the kids country, there was a lot of people who were going there from care leavers. So those people may or may not have heard of Speaker Box, but hopefully they will do after the kids have discussed about it.
And the other group I was thinking about was young carers. young carers often are in poor circumstances because they're looking after somebody at home who can't work. So their income is limited, therefore their housing is poorer. You know, so they have they have the extra burdens of looking after those people, maybe their parents or grandparents or siblings.
In some cases, both.
Yes, indeed. So they should be on your forum, and there is a Southwark Young Carers group as well. They quite a useful group to be part of.
If I can't find them, can I email
Yeah.
Julia so she can email, or I can email you directly, I guess.
Okay,
and
I'll give you my card.
give me, if I can't find them, but
Yeah.
I normally find things.
But that was the other group who have, a hidden mental health problem because they're having to be so strong for the rest of the family.
Absolutely right.
Yeah, I mean, I just want to, thank you again, Alicia, for sharing that with us. I mean, when we talk about mental health, there are so many things that can be associated with it. When people lose their job, obviously it's going to affect their income. It's going to affect, we're talking about housing, they may not be able to pay their rent, they may not be able to do all the things they used to do. We affect the children, we affect the whole family. And you can then see where that is leading to. You become depressed, it can affect so many aspects, physically, mentally, we affect you. So therefore, yes, in some cultures, yes, it's a taboo to talk about it, especially when it comes to men. We want to bottle things in, and then it's only when people react, even sometimes it could act violently, which will affect the partner and the children as well, which can lead to all sorts of things. And also, we also need to remember that there are some communities that, for whatever reason, they don't want to engage the wider community. The Southeast Asian community, which is the Chinese, maybe also one, because they are very self-sustained, because there are some cultures that are very proud of doing things on their own. So therefore, sometimes when they face some challenges, they may not be willing to share that with the wider community. One, because they are not part of it at the beginning anyway. Because I remember about 15 years ago, when I used to work closely with before I became a councillor, I used to work with the community involvement and development unit of Southwark Council. When we had the people from Sierra Leone coming in, for the first time, of course, there are few Sierra Leone, but the influx of Sierra Leonean coming to the community. And then the council then put some resources to how we can actually develop some scheme in order to make sure we develop our community so that we can empower them and also make sure they are able to be part of the wider community so that they have access services and so on. Whereas there are some communities that have been here longer than that, for whatever reason, they don't want to be part of it. Yeah. And therefore, when we find ourselves in a situation like this, only the next, maybe second or third generation who are now being part of the British community and probably forgotten about all the extra challenges their parents or grandparents brought with them. They are now fully part of it, they're integrated. They're the ones that are now speaking out, and they're the ones that are affected more. So probably what we need to do more now is to see how we can reach those communities and see how we can do more before it's too late. But I think the council, from history I know, we've been actually very engaging in terms of communities. At the same time, if communities don't want to engage, we can't force them. But thank you for sharing that with us.
I think TNRAs should play a very important role in that because they're representing tenants, and if the tenants in their estate or street have a Chinese community, Asian, Muslim, whatever Eastern European community, and they know that they're not engaged or they're aware of these issues, I mean, we're going to hopefully feed back to our SGT, to the bigger one, but I think they have a role to play as well.
Excellent. I think I'd like to thank you for that great contributions. I wanted to just dial in. I had a discussion with the strategic director yesterday about, and we asked what would be useful, from his perspective, and he actually said that he was concerned about what support we give in Southwark to children of parents with mental health. Just so you know that we're looking at that. But also, and this is obviously this comes up for young people as well, the issue of either parents or young people with dual diagnosis. You know, you might have a mental health diagnosis, but then you might, on top of that, have an addiction to alcohol or drugs. Do you see what I mean? So it all starts to get quite complicated. So, you know, I know that he was thinking that we might be able to help, you know, in terms of scrutiny. Oh, sorry, I'm just passing that round. In scrutinising that. So if you could make a note of that while you're collecting evidence.
Which strategic director? I know there's
David Quirk-Thornton.
David
Quirk-Thornton.
And we're still trying to think of who should be on our board. Maybe we said senior officers, but maybe we might ask him if he'd be happy to join that. So it's a nice round table.
Might be worth asking the MP as well, Neil Coyle, because he has personal knowledge, because his mother, he openly tells everybody his mother had mental health problems, and he was very much in danger of being taken into care because of that. So he'd be worth. Yeah, it was a very hectic, chaotic family when he was little.
I know we will certainly follow that up. I mean, they're finding more and more that they're getting a bigger and bigger brief, but they see it. It's their friends, and I think that's what's great. You know, when I spoke to Kieran was like, "What? They're talking about Kids Company?" He read the report. He read your whole report.
Oh right, okay.
You know, but you know, I think a lot of young people from Kids Company would have read that report if they knew about it. But I wouldn't put it on the council.
Yeah.
Primarily, it's up to the community as well. The council is doing the right thing in putting it in the public domain, but it's up to the community to get that and share it with each other.
Well, we haven't finished that. We're still looking at that. When we look at our work plan, we heard from, in fact, that report was from David Quirk-Thornton, because he was leading it not only from Southwark, but he was leading it for the whole of the London local authorities. So our interest is about what happens to all the young people that were using that service from Southwark, and we're really concerned about people that may have been under the radar. So part 2 of our scrutiny into that will involve talking to organisations that help people that often fly under the radar, but it will also involve talking to young people that transferred over as a part of that process. But, you know, if you just we can keep you informed, you know, of that, and you're welcome to join us. In terms of taking this forward, though, we'll be scrutinising, as I explained, the strategy, and we'll be having a round table of our own, and you'd be welcome to join that to give evidence.
Yes.
Or, you know, to tell us what you think of the strategy. So, yeah, of course, there's an open invitation. And we're going to have to try and make that as seamless as possible, because we'll be doing that with the Health Committee, remember that? So that's chaired by my our fellow councillor, Rebecca Laurie. So we'll be doing that joined up bit, which is great from your perspective, because we'll be looking at children up to adults and everything in between. So that would be great. Is there anything, I'm going to look to Julie now, who basically clerks for this committee, but also has quite a lot of say and perspective. Is there anything we should ask before colleagues disappear, before David and Richard disappear?
No, I think you've done a really good job. We did discuss as well, so that you've for coming back next meeting for an open spot to talk generally about issues. If that's something that you still and the committee still think would be useful.
Well, that seems timely, doesn't it? Because we'll be catching up on the Kids Company. You'll be interested in that. We'll be catching up on the issue of youth and the budget, Councillor Mills will be there, who you've already met and got some rapport with, so you'll find that interesting. So yeah, okay, sounds good.
Is it okay for them to have a copy of these? Because there's bits in there about the mental health and the kids company they might want to read up on.
The agendas.
You see these? Is it right?
Yeah, they're all public.
Oh yeah.
Of course.
Yeah, I've read some of them.
Yeah, they've seen them.
But if you want to give us a copy.
Yes, help us out.
Yeah, help yourself, of course. Thank you, Sandra. Good. Okay, have you got any further questions for us before you go?
For me, thank you very much for taking time to speak to us, and hopefully we continue the dialogue. And
well, it's a bit. I hope it'll be a bit more than a dialogue. I mean, we've all, we're all committed to action, aren't we? And we're occupying the same space. So I look forward to a collaborative and productive relationship. Thank you very much for your time. See you next time. And our numbers are all on the website, so if you need to talk to any of us in between, don't hesitate to call.
Yeah, and I'll probably try and keep you into the mailing of what the forum's doing, so you're just aware, because other things might pick up. And
I'd find that really useful. Thank you.
David, you got my details then?
Yeah.
Yeah.
Ben, thank you very much for coming along. It was great to have you. See you soon.